All right, we're back here with Dr. Bedai. Dr. Bedai, we talked about missing teeth and how they affect the good looks and how they make faces shrinking, cavemen look years older. Now, give me some ideas. Give the people listening here some of the major, all of the major ideas on how missing teeth can be replaced. What avenues do we have available?
So basically, Helmut, you're looking at the spectrum of things that people can do to have these missing teeth replaced. Is that correct?
Correct.
Okay, so very good. So there's a multitude and a variety of things that people can do. One thing is not always correct. It's not a one-size-fits-all for every situation. So let me go over some of the major possibilities that you have. Number one is bridge work. Okay, and bridge work is a series of caps or crowns that are linked together that fit over the other teeth, and they're permanent. They're stable. It means that they don't come in and out of your mouth, and they're made to look very, very natural, and they can replace missing teeth.
That's where you guys grind the tooth down, or grind a couple tooth down and make another one hanging in between to fill the hole in it, right?
Exactly. You like to use the word grind. I like to use the word shape. It's a little more politically correct, but get the idea that you're right. You shape, for example, if you have a missing tooth in the back and there are two teeth on the other side, you shape the two teeth on the other side, and then a tooth is suspended in the middle, and it's called a bridge, just like you would have a bridge over a road surface. It's fixed into place, and now you have all three teeth back again, and it looks and functions just wonderful under the right circumstances.
Okay. What else?
Well, one of the more popular things for nowadays is basically dental implants. And dental implants are nothing more than artificial roots that are placed into the jaw. So when you lose a tooth, don't forget you also lose the root. You lose the support that is holding that tooth in from the jawbone. So dental implants are placed into the jaw, and then you can construct teeth on top of the dental implants. That's becoming a very popular and a very, very much more predictable way, especially with today's technology of replacing missing teeth.
Okay. So people say, so basically what you're saying is when you have a dental implant, you're filling the natural root of the tooth again so that, again, the bone doesn't shrink. Is that what it is?
Exactly, precisely. Great point that you brought up in there. One of the things that dental implants will do is it will keep the bone height from where, keep the bone height from where it is and from shrinking anymore. That implant in there will stabilize the actual jawbone in there, and as we've talked about in an earlier video, it can help with the youthfulness of the face and keeping things from deteriorating rapidly in there. Implants today, Helmut, amazingly simple to put in, some of them under the right circumstances. People don't want to hear about surgery, but quite frankly, some of the teeth on the bottom that we put in takes me 5 to 10 minutes to actually put the implant in place. And a lot of times it's quicker than a tooth extraction, and it's far, far easier than an extraction of a tooth.
Interesting. Wow. So a person doesn't have to be, one of the things which people don't like with dental implant is that they might have to, or at least that has been the opinion, they might have to run around 2, 3, 5, and even 6 months before the crown can be placed on it, or even before once the tooth is extracted, before the metal rod, the titanium rod or whatever it is, can be put in. Is that still the case or not anymore?
Well, they have immediately load implants that are called immediate load implants, and that means that you can put the final restoration on right away. The best case scenario that we have is, for example, let's say it's a tooth on the bottom where a bottom molar is missing. If you have plenty of bone in there, then once we place the implant, typically I will wait for about 3 months for the implant to really integrate into the bone so that it's good and solid in there. Are there cases that you can go ahead and put an immediate on there if it needs to be? Let's say if it's more towards the front, yes, you can. Or is there a way that you can put that implant in and have something look good in the front for while it's healing over? You can do that also.
So you actually don't walk around with a missing tooth necessarily for many months.
We don't want you toothless.
Okay.
No.
All right. Now, so we covered a crown, a bridge basically. We covered an implant. And what is it all about this partial stuff and this flips, flops, or whatever the hell you call that stuff?
Okay. Well, flip-flops you wear at the beach. So
okay. Okay. Well,
you're talking about partials. And partial dentures are replace missing teeth, but they are removable. They actually come in and out of your mouth. So they hook on the remaining teeth that are in there. Now they can actually be made with crowns around them so that you'll never tell that they have any hooks on them. And there are many cases where partials need to be done because there's so much bone that is lost in there, or the patient does not want to have an extensive surgery to do implants. That they're really they qualify for partials, and they work actually very, very well. So I don't want to dismiss partials as being a bad way to replace teeth. They're an excellent way to replace teeth if that's what one needs to do. The biggest distinction between a partial and either a bridge or an implant is the bridge or the implant is fixed, meaning nothing comes in and out of your mouth. And in those two circumstances, you can get things feeling as natural as possible. On a partial, you have metal framework, you have some plastic, which is the pink acrylic around it with the teeth. So you have more, let's call it paraphernalia in your mouth to get used to, but they can work very well. And one of the things that you were alluding to, Helmut, which is called a flipper partial, is just a small little partial that may fit up if you have a single missing tooth in there, which is fine. They are normally used for an intermediate type of a treatment in there, or a treatment that's used while the person is planning on getting bridge work or an implant in that area.
Right. Okay. So if a person has many teeth missing and is kind of waiting for implants, wants to get implants, but let's just say we know that they're a little bit more expensive than, let's say, a denture or some partial denture, right?
Right.
And so now we found out from you that the tooth loss of not replacing the teeth with like implant will be making a person's face cave in. So if he gets dentures or partial dentures, that will happen. So would you suggest to a guy and say, look, you can't afford the implant today, start saving up for it. In 1 or 2 years you can have it. Your bone loss will be a little bit, but not yet that heavy. And so in the meantime, you have your teeth, but let's go and plan towards a permanent solution which will keep you basically young. Never mind eating better a little bit and biting better.
Sure. Yeah, absolutely. A person can, have the immediate situation handled with, let's say, with some partials and getting used to the full function of the teeth while they're planning and having implants and permanent things. That's a very viable and actually a logical way of doing it.
Well, wonderful. Well, thanks for explaining ways on how we can basically replace teeth and shed some light on it.
Let's not forget about dentures.
Go ahead.
So, the final way, and probably one of the most well-known ways of replacing teeth when all of the teeth are missing is with full dentures. And full dentures is nothing more than plastic, which is pink acrylic, and also usually high-impact plastic or porcelain teeth that restore and do the job of a regular dentition. The thing about dentures is nowadays dentures can actually be put in with attachments on the bottom, a couple of implants, so that the lower denture holds in place a lot better, because most people have a problem with the lower denture as opposed to an upper denture. But briefly, because on this we were talking about ways of replacement, that basically covers all of the items of replacement in there.
Okay. And so if a person has a denture, will his jaw bones shrink or not?
Absolutely. If they have the dentures in there, even the most well-constructed dentures, which puts the facial profile back, and dentists are great at doing that, filling things out and getting them the proper bite. After X amount of time, you're going to see the faces of the jawbone face is going to disintegrate or resorb to a greater or lesser degree. Different things for different people. And you'll see some sagging and sliding out of the dentures. So if a person has dentures, obviously they need them checked. They will need them replaced with new dentures that rebuild things in there, or they can always stabilize them with implants and, basically stabilize the jaw in that fashion.
Well, all right. Anything else before I cut you off again?
Oh, no, you're allowed to cut me off now. We got all of the major stuff in there. So, Helmut, I think that pretty much reviews all of the different ways on replacing missing teeth.
Well, wonderful. Okay, people can call you on the website below or call you on the phone number which we're going to show in this video.
Absolutely, absolutely. We always accept new patients and love to have them in our practice.
Well, wonderful. Bye-bye.
Bye-bye.